Our next honoree is Tiffany McManis, Alumni Fellow for the School of Nursing. Tiffany has been director of the Washburn University Student Health Services since 2018, overseeing the clinic offering medical services to the Washburn community. She started there in 2012 as an advanced practice registered nurse and became interim director in 2017. She has served on several university-wide committees at Washburn, including the COVID-19 University Steering Committee, Health and Safety Committee, and Student Life Wellness Committee. As a leader at Student Health, she has developed numerous department policies to improve the safe operation of the clinic and the overall health at Washburn. Tiffany worked for several years as a surgical RN and earned certification as an RN First Assistant. She has been on Washburn's Harmony J. Hines School of Nursing adjunct faculty since 2009, and she serves on the Live Well Shawnee County Sexual Health Collaborative. Tiffany, on behalf of the Alumni Association and the School of Nursing, we are pleased to honor you as a Washburn Alumni Fellow.
Well, thank you all so much. Thank you, first of all, to the School of Nursing for the nomination. I appreciate you so much. My family, of course, I certainly would not be here without all of them. And then my team from Student Health, thank you. You guys are my rock every single day. But I stand here before you today as a product of what can happen for you at Washburn University. Back a few years ago, I applied to Washburn and I got waitlisted. Yeah, at that time, every school of nursing in Kansas had a wait list because it was so competitive to get in. So I actually did not get my undergrad here. I got that at a little place down the road called Baker. But fortunately, when I hit a point in my life where I was actually a business owner for a surgical staffing company. I was a partner in that business, and we had started a first assistant school, and things were going really, really well. And this might sound crazy, but that's when I decided to leave. Because I wanted to be a nurse practitioner, and I knew that if I stayed, I would never get to be a nurse practitioner. And somewhere in there, I got a postcard from Washburn University about their nurse practitioner program. So if you guys ever wondered if those mailers help, they do. So I came to learn about the master's program at Washburn University, and this time I didn't get waitlisted, I got in. And I got the opportunity to learn and work alongside all these wonderful nurse leaders in the School of Nursing. And when I tell you then, that it was true, and I can assure you now it is still true, they want you to succeed. They want everyone to succeed. And I know that you feel that across this campus, no matter what department, no matter what school, no matter what program. People at Washburn want you to succeed, and I feel so blessed and fortunate every day to be able to be a part of what helps keep students here, what helps keep them healthy and going to class and getting their work done so that they can be successful. And I know when I finished up my master's, they talked to me about the DNP program, and I thought, sure. But as fate would have it, after I left for a while and worked some other places, I actually wound up back here because I needed to have a job that was more conducive to me seeing my family while they were awake. And there happened to be an opening in student health, so I reached out to the director, who had been one of my professors, and I interviewed with her. Interestingly enough, she asked me what my goal was if I got the job. And this might sound a little bold, but I told her I wanted her job. Fortunately, she didn't get mad, and she kind of looked at me and she shook her head and she said, "Yeah, you're right, I'm not going to be the director forever." So I fortunately got hired. And then the next year was part of Leadership Washburn, which I know several of you have probably participated in that program here on campus. But that was a wonderful conduit for me to meet other people across campus and to learn more about Washburn. And I feel like it turned me into a better provider in student health because I made those connections across campus and we know each other, and I know that if somebody needs help somewhere, I know who to connect them to, and that's really fantastic. And I probably shouldn't mention the pandemic, but I'm going to mention the pandemic because that was such an incredible time of transition, not only for me, but for the university. I'd only been the director for a couple of years. I was finishing up my doctoral degree and here because of the wonderful pathways that they offer you when you're a full-time employee. So, again, I did get those opportunities to work with so many leaders across campus. And I didn't know that in March of 2020, I was going to suddenly be the medical expert for the university. It happened very suddenly, didn't it, Dr. Farley? It was one of those times where you find yourself in a leadership role that you didn't expect. But we all moved forward together, and we all learned together, and we all figured it out. And we're here on the other side of it. So thank you to everyone here today. I appreciate all of you. Thank you again to my colleagues at the School of Nursing. You guys are the best. And again to my team at Student Health and my family. Thank you.